As President Trump pushes to have stay-at-home orders lifted and open up parts of the country, more than 45 economists, social scientists, and lawyers and ethicists say there is one factor that is a major step necessary to put Americans back to work, one that we've been talking about for some time now, and that is dramatically upscaling testing. Joining us now, professor at Harvard University and director of Harvard's Center for Ethics, Danielle Allen. She is one of the authors of the newly released report entitled Roadmap to Pandemic Resilience. It is the nation's first comprehensive operational guide for mobilizing and reopening the U.S. economy amid the crisis. So we all agree about the testing. Do you have any idea, given what you've looked at, how long it would take to get there at the pace that the U.S. is going now, which is sort of state by state, as opposed to a national mobilization to get testing underway, mass testing?
Sure. The goal is to reopen and stay open. And to do that, we have to hit a target of 5 million tests by June. We're currently on a pace of about 1 million tests a week. We need 5 million tests a day. So the fact is that states are working hard to ramp up testing, but it's very hard to get the level we need without some kind of centralized coordination. So at the end of the day, we really do need the federal government, either White House or Congress, either could do it, to step in with the Pandemic Testing Board and activate that supply chain and scale up.
So that nationalized, that government coordination is the only way to ramp up the testing? There's no way, because I only ask this because the president appears to refuse to do that. He says it must be done locally, that he can't stand on a street corner or do testing in parking lots of Walmarts, that it's important, it's handled by the local governments. Is there any way to get to the number we need so we can safely reopen without having to shut down again?
So it's absolutely the case that tests can and should be administered locally. We need to activate all 3 levels of our federal system: the local level, municipal officials and public county health officials, the state level to build out frameworks for testing, and then the federal government very specifically to activate the supply chain. So all we need the federal government to do is to actually coordinate across different elements of the supply chain, as well as to invest in an innovation pathway. The truth is Congress can do this too. It doesn't have to be the White House. The White House can do it. I hope the White House will do it. Congress could do it. Congress could do it by working with compacts of states. So we have actually lots of resources within our federal system to make this happen. And it's really important that every part plays its role. And at the end of the day, yes, we do actually want local municipal leaders and county public health officials figuring out how to build out testing, tracing, and supported isolation programs in their communities. These programs will have a slightly different shape everywhere, as they should. And if you're going to do massively ramped up testing, tracing, and supported isolation, it's important that the people who are administering that are really trusted by the communities in which they're working. That really does require local administration. So what we really need the federal government to help with is the innovation pathway for the testing.
Excellent. Katty Kay has also been writing about the difficulty of reopening, and she has a question. Katty?
Yeah, Danielle, I read the Safra Center's report and I read the AEI report and the Center for American Progress report. They have some differences, but they all have certain similarities as well. They have the testing, but beyond the testing, there are other steps, aren't there? There's the contact tracing and more testing, and then the whole issue of quarantine and how you do that. How much progress is being made on those later steps? And there's rightly a lot of focus on ramping up the testing, but there are also these other steps that are going to have to take place, aren't there? And how much progress are we making on those?
That's terrific. We are making good progress. So on tracing specifically, you've seen Massachusetts and Washington both take the lead by really trying to develop significant personnel ramp-ups for contact tracing. Australia set a good example. They've also been ramping up in that regard. Johns Hopkins Center for Health Security has recommended adding 100,000 contact tracing personnel to sort of national central structures at Department of Health and Human Services for deployment to hotspots around the country. And Congress is working on some legislation, I believe, to invest in contact tracers in that way. So we really can build out manual contact tracing personnel. There's a terrific example actually in Eastern Texas where the city and the public county health officials have come together and they've redeployed firemen and police and restaurant inspectors and so forth to achieve the contact tracing personnel they need for their region. The truth is we have the people to do this. We also have incredible unemployment. This is an opportunity to redeploy people. So we're making progress. Supported isolation is also key. Quarantine is for when you don't know whether people have it or not, and isolation is for people who are COVID positive. 20 to 40% of carriers are asymptomatic. So that's where we really need isolation and supported isolation, because people have to be able to stay off of work for a few weeks. They can't lose their job by taking themselves out to keep the rest of them safe, right? So that's where we have to work on the supports.
All right, Danielle Allen, thank you so much. We greatly appreciate it. Just want to say really quickly, Mika, we talked about polls and how the president's polling has dropped since he started these daily press conferences. We talked about him losing 49 to 42% in the overall poll. But if you dig down deeper into that NBC News Wall Street Journal poll, even in the key swing states of Arizona, Colorado, Florida, Maine, Michigan, Minnesota, Nevada, New Hampshire, North Carolina, Pennsylvania, and Wisconsin, he's losing 49 to 43%. For the president, publicly, less is more. And that does it for us this morning. Stephanie Ruhle picks up the coverage right now. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.